Good morning, everyone, and welcome. I'm delighted to have you here today. Today's presentation is titled Role of Quality Assurance, with a focus on the accountability framework. Over the next few minutes, we'll explore how quality assurance plays a vital role in our work and the key frameworks that support accountability. So, let's get started and dive into this important topic. Now, let's delve into what quality assurance, or QA, really means. Essentially, it's a systematic process, so it follows a structured approach, aimed at making sure that our products or services meet the specific requirements, and most importantly, the expectations of our customers. The goal here is to prevent defects before they happen, which is why we focus on planned activities and standards that guide our work. It's important to remember that QA isn't just a one-time check. It's an ongoing, comprehensive process. It's also independent and risk-based, meaning it operates separately from the production teams and focuses on identifying and mitigating risks early on. The key idea is consistency, making sure that every product is developed, manufactured, tested, and distributed in a way that complies with all relevant regulatory requirements. But beyond compliance, QA promotes a culture of continuous improvement, encouraging us always to find ways to do better. When we look at the entire product lifecycle, QA acts as a backbone supporting quality at every stage, from initial design to final delivery. So, ultimately, QA isn't just about meeting standards. It's about fostering a quality culture that drives us toward excellence at every step. Let's take a closer look at the different facets of quality assurance in our organization. Starting with plant QA, this focuses on the overall quality of our manufacturing environment and processes. It's about ensuring that everything happening on the plant floor meets our strict standards. Next, we have analytical QA, which deals with the testing and analysis of raw materials, in-process samples, and finished products. This helps us verify that our products meet specifications at every stage. Developmental QA is all about supporting new product development, making sure that quality is built into our products from the ground up. Validation QA, on the other hand, confirms that our processes consistently produce quality outputs. It's about proving reliability. Regulatory and compliance QA is crucial because it ensures we meet the legal and regulatory requirements across different markets. Without this, we risk non-compliance and potential penalties. QMS, or Quality Management System, /documentation, QA emphasizes the importance of maintaining accurate, thorough documentation. This underpins all our quality efforts and ensures traceability and accountability. Supplier QA is about working closely with our suppliers to ensure that their materials and components meet our quality standards before they even reach us. It's a proactive approach to quality. Corporate QA broadens the scope to align quality strategies across the entire organization, fostering a culture of continuous improvement. Sterility and micro QA focus on preventing contamination, especially critical in our sterile products. Microbial testing and sterilization validation are key here. Digital/data integrity, QA safeguards the accuracy and reliability of our data, ensuring that our electronic records are complete and unaltered, which is vital for audits and regulatory submissions. Finally, when we talk about quality assurance classification, we're categorizing these activities to create a structured approach to maintaining and improving quality across all areas. All these components are interconnected and essential for delivering safe, effective, and compliant products. They support our overall commitment to quality and help us build trust with our customers and regulators. Now, let's look at the key responsibilities that ensure our manufacturing processes meet the highest standards. The focus here is on shop floor and manufacturing compliance, which is critical to maintaining product quality and patient safety. One of our main areas is GMP compliance, meaning good manufacturing practice adherence throughout all stages. This starts from line clearance, where we ensure the line is ready and free of contamination, all the way to batch release, confirming that each batch meets quality specifications before it goes out. A proactive approach is essential. We aim to prevent deviations before they occur, rather than just reacting to them. This involves thorough review of batch manufacturing records and batch packing records to verify that every step was completed correctly and consistently. Oversight of line clearance and in-process controls, or IPC, helps us catch issues early and maintain process integrity. Handling deviations, out of specification, or out of trend results, known as OOS and OOT, is also a key responsibility. Prompt and effective CAPA, or corrective and preventive actions, are implemented to address root causes and prevent recurrence. Change control processes are rigorously followed whenever modifications are needed, ensuring continued compliance. Throughout all these activities, strict adherence to CGMP standards during manufacturing and packaging is non-negotiable. Our plant and manufacturing quality assurance teams play a vital role in overseeing these processes, ensuring that every product leaving our facility is safe, effective, and compliant with regulatory requirements. These responsibilities are interconnected and form the backbone of our commitment to quality and compliance. Now, let's focus on the core of laboratory data integrity and compliance. As the guardian of this data, my role is to ensure that every piece of information generated in the lab is accurate, reliable, and compliant with all necessary standards. This is crucial because we rely on test results to make informed decisions about product quality and safety. My responsibilities include reviewing analytical raw data and test results meticulously. This means checking that the data is complete, consistent, and free from errors. When we encounter out-of-specification or out-of-trend results, or any invalid tests, I investigate thoroughly to understand the root causes and prevent recurrence. I also oversee method validation and verification processes, ensuring that our testing methods are fit for purpose and produce trustworthy results. Additionally, maintaining compliance with stability studies is vital, as these studies confirm that products remain stable over their shelf life. Data integrity, following the ALCOA Plus principles, attributable, legible, contemporaneous, original, and accurate, is at the heart of everything we do. I verify that data meets these standards consistently. Instrument qualification and calibration reviews are also part of my role, ensuring that our laboratory equipment performs accurately and reliably over time. Finally, I oversee analytical quality assurance, which encompasses all these activities to uphold the highest standards of data integrity and compliance. This role is integral to maintaining the trustworthiness of our laboratory results, supporting overall quality, and ensuring regulatory adherence. Now, let's focus on embedding quality in product and process development. This is crucial because quality shouldn't be an afterthought. It needs to be integrated throughout the entire development cycle. When we talk about moving from lab scale to commercial scale, it's not just about increasing quantities. It's about maintaining consistent quality and understanding the risks involved at each step. That's where quality by design, or QBD, and risk-based development come into play. They help us build quality into the process from the beginning, reducing variability and ensuring the final product meets our standards. Another common challenge we see in R&D are documentation gaps. These gaps can lead to gaps in understanding, traceability, and compliance, so thorough documentation is essential. Moving to key responsibilities, I oversee formulation and process development activities to make sure they align with quality goals. I review development reports carefully to catch any issues early. Supporting scale-up and technology transfer is also vital. We need to ensure that what works in the lab can be reliably produced at a commercial scale. Compliance with design of experiments, or DOE, principles is another critical area, helping us optimize processes systematically. And of course, all our development documentation must adhere to QBD principles, ensuring that quality is built into every step. Lastly, developmental quality assurance plays a pivotal role in guiding and verifying that our processes and documentation meet the highest standards, ultimately supporting our overall goal of consistent, high-quality products. Let's talk about focus today. Lifecycle validation compliance. This is about proving that our processes consistently work and meet quality standards throughout their entire lifecycle. It's essential because it ensures product quality and regulatory compliance over time. We'll look at the process validation lifecycle, which covers all stages from initial validation to ongoing verification. It's important to understand the difference between concurrent validation, which is performed while the process is running, and prospective validation, done before production begins. Both approaches help us confirm that our processes are reliable. Revalidation is also key. As processes change or if issues arise, we need to revalidate to ensure continued compliance and effectiveness. Now, let's highlight key responsibilities in this area. First, process validation includes activities like process performance qualification, or PPQ, and continued process verification, or CPV. These help us monitor and confirm process consistency over time. Cleaning validation makes sure that cleaning procedures remove contaminants effectively, preventing cross-contamination. Analytical method validation is about confirming that our testing methods are accurate and reliable. Equipment, utility, and system qualification, covering design qualification, IQ, OQ, and PQ, ensure that our equipment and systems are suitable and functioning correctly. Computer system validation, or CSV, guarantees that our digital systems operate securely and reliably. Finally, continued process verification, or CPV, is an ongoing activity that helps us monitor the process during commercial manufacturing. All of these responsibilities are overseen by validation quality assurance, which ensures that every step meets our quality standards and regulatory requirements. Connecting all of this to our overall theme, effective lifecycle validation compliance, is what underpins the quality and safety of our products. It's a continuous, proactive approach that safeguards our processes and, ultimately, our customers. Let's talk about the focus on quality management system governance. Ensuring compliance with SOPs is fundamental, as it sets the foundation for consistent quality practices across the organization. Building a robust QMS in accordance with ICH Q10 is at the core of our approach, providing a structured framework for quality assurance and continuous improvement. Change control and risk management are critical components. It's not just about managing documents, but about fostering a quality culture that actively identifies and mitigates risks. This transition from mere documentation to embedding quality into our daily culture is key for sustainable compliance. Now, let's look at the key responsibilities involved. First, SOP management and document control ensure that our procedures are up-to-date and accessible. Establishing and maintaining the QMS keeps our quality systems effective and aligned with evolving standards. Risk management, guided by ICH Q9, helps us proactively address potential issues before they impact product quality. Monitoring quality metrics and KPIs allows us to measure performance and identify areas for improvement. An effective training system ensures our team understands and correctly applies these quality standards. Management review sessions are vital. They help us evaluate our quality performance and reinforce a culture where quality is everyone's responsibility. Finally, documentation and systems quality assurance serve as the backbone of our compliance efforts, ensuring all processes are transparent, controlled, and continuously monitored. When we integrate these elements, we create a resilient QMS that not only meets regulatory requirements, but also drives excellence in our organization. Now, let's focus on regulatory readiness and inspections. Preparing for an unexpected inspection is crucial, so having a solid plan in place helps us stay confident and organized. When we encounter issues like 483s, warning letters, or CAPAs, it's important to handle them effectively and learn from these QA experiences to improve our processes. Regulatory observations are part of the process, and knowing how to respond promptly and appropriately ensures we maintain a good standing with regulators. Key responsibilities include ensuring compliance with standards from ICH, WHO, US FDA, EMA, and MHRA. This means staying up to date and aligned with all applicable regulations. Audit readiness is another critical aspect. Being prepared at all times helps us demonstrate our compliance seamlessly. Responding to regulatory queries and observations quickly and accurately shows our commitment and professionalism. Managing inspections involves not just handling the visit itself, but also following up with CAPAs to address any identified gaps. Conducting regulatory gap assessments regularly allows us to identify potential issues before they become problems during inspections. Ultimately, all these activities are part of our broader compliance and regulatory quality assurance efforts, which support our goal of maintaining a strong, compliant quality system that can withstand any inspection or review. Now, let's turn our focus to supply chain quality assurance, which is a critical aspect of extending GMP beyond the factory. Managing supplier changes without risking compliance is essential to maintaining product integrity and patient safety. Key responsibilities in this area include vendor qualification and approval, ensuring that any new supplier or vendor meets our strict standards before we do business with them. Regular supplier audits and ongoing performance monitoring are also vital. They help us identify potential issues early and ensure continuous compliance. We also need to pay close attention to raw materials and packaging materials, making sure they meet all quality requirements. Establishing clear quality agreements with our suppliers is another important step. They define expectations, responsibilities, and quality standards for both parties. Change notification management is also crucial. Whenever a supplier change occurs, timely communication helps us assess and mitigate any potential risks, ensuring that compliance is maintained throughout the supply chain. All these elements, vendor qualification, audits, material compliance, quality agreements, and change management, are interconnected and form the backbone of robust supplier and vendor quality assurance. By managing these effectively, we can extend our GMP principles beyond the factory walls and ensure the highest quality across the entire supply chain. Now, let's turn our focus to organization-wide quality governance. This is about ensuring that quality isn't just a local effort, but a core part of our entire organization. We're driving quality across multiple sites, which means we need to create a consistent approach that works everywhere. One key aspect of this is harmonizing our quality systems. This helps us ensure that all sites follow the same standards and procedures, making our quality efforts more effective and aligned. When we talk about quality governance, we're moving from policy to practice. It's about translating our policies into real actions and daily operations that uphold our standards. Monitoring quality metrics is also crucial. They give us data-driven insights into how well we're performing and where we can improve. Key responsibilities in this area include setting a clear global quality policy and strategy. That's our overarching framework. We also oversee quality across multiple sites to maintain consistency. Harmonizing SOPs, or standard operating procedures, across sites is essential so everyone is on the same page and following the same processes. Another important element is quality risk management. By proactively identifying and addressing risks, we can prevent issues before they happen. Developing a strong quality culture is also vital, making quality a shared value that everyone embraces. Finally, our corporate or central quality assurance team plays a critical role in supporting all these efforts. They provide oversight, guidance, and ensure that our quality governance truly permeates every level of the organization. All these elements together help us maintain high standards and continuous improvement across our entire organization. Let's talk about contamination control and sterility compliance, which are absolutely critical in our processes. The key concept here is zero tolerance for contamination, meaning we cannot afford any microbial intrusion at any stage. This is where aseptic processing comes into play, ensuring that our products remain sterile throughout manufacturing. One of our essential validation steps is media fill validation. This process simulates the actual production to verify that our aseptic techniques are effective and that contamination is kept at bay. Now, focusing on key responsibilities, environmental monitoring oversight is vital. We continuously track the environment to catch any potential microbial presence early. Aseptic process validation, including media fills, confirms that our procedures are robust and reliable. Our contamination control strategy, or CCS, is the blueprint for preventing contamination, combining best practices, controls, and continuous monitoring. When issues do arise, microbiological investigations help us identify the root causes and prevent recurrence. Sterility assurance level, or SAL management, is about setting and maintaining a scientifically justified level of sterility confidence. Lastly, sterility assurance and microbiological QA are the final checks, making sure everything aligns with our strict standards for quality and safety. Overall, these elements form a comprehensive approach to safeguarding product sterility, which is at the core of our commitment to patient safety and product quality. Let's take a closer look at the focus on people, behavior, and competence. When we talk about quality culture, it's important to go beyond just SOPs and checklists. It's about fostering a mindset where commitment to quality is ingrained in every aspect of our work. Moving from simple compliance to genuine commitment is key here. One of our main responsibilities is implementing GMP and regulatory training programs. These are essential to ensure everyone is up to date and understands the standards they need to meet. But training alone isn't enough. It's equally important to assess how effective that training is. Are our team members truly applying what they've learned? That's what we aim to evaluate. Building a strong quality culture also involves continuous improvement. We should always be looking for ways to enhance our processes and reduce human errors. Human error reduction programs are part of that effort. They help us identify potential pitfalls and proactively address them. Lastly, all of this ties back to our overall goal, creating a robust training and quality culture. A culture where quality isn't just a requirement, but a shared value that guides our daily actions and decisions. This approach helps us maintain high standards and ensure the safety and efficacy of our products. Now, let's talk about the importance of trustworthy data and digital systems in ensuring quality after a product is released. This is critical because once a product hits the market, we need to continuously monitor and improve its quality based on real-world data. Turning data into actionable insights allows us to identify and address issues promptly, ultimately enhancing the safety and effectiveness of our products. Regulatory reporting of quality complaints is a key aspect here. It's essential that we document and communicate any complaints or adverse events to the relevant authorities accurately and promptly. This not only ensures compliance, but also helps protect patients and users. Our key responsibilities in this phase include handling complaints effectively, reporting adverse events, and managing product recalls or mock recalls to prevent any harm. Conducting thorough product quality reviews, such as PQRs or APQRs, helps us assess overall product performance over time and identify areas for improvement. Post-market surveillance is another vital component. It involves ongoing monitoring of our products in the real world, gathering data that informs us about long-term safety and performance. Pharmacovigilance and post-market quality assurance are integral here, ensuring that we stay proactive in safeguarding public health. Altogether, these activities form a continuous cycle that sustains and enhances product quality after release, aligning with our overarching goal of maintaining trust through reliable, high-quality products. Today, I want to focus on the importance of trustworthy data and digital systems in our quality assurance efforts. As we move through digital transformation, handling electronic data and records has become a critical part of our work. One of the key challenges we face is maintaining data integrity, which is essential for ensuring the reliability and accuracy of our information. This involves several responsibilities, starting with data integrity governance, often guided by principles like Alcoa Plus, which stands for attributable, legible, contemporaneous, original, accurate, and the plus includes additional aspects like consistent review and security. we also need to be very clear on electronic records and signatures, especially in compliance with regulations like 21 CFR Part 11. This regulation sets the standards for electronic records to ensure they are trustworthy and equivalent to paper records. Another vital area is audit trail review. Keeping a detailed record of all changes and access to data allows us to trace back and verify the integrity of the information at any point. It's a crucial part of our accountability. Cybersecurity and system access controls are equally important. Protecting our digital systems from unauthorized access helps prevent data breaches and maintains the trustworthiness of our data. Ultimately, all these elements come together in data integrity and digital quality assurance. They form the backbone of a trustworthy, compliant, and effective digital ecosystem, one that supports our overall goal of high-quality, reliable products and processes. For further support, please don't hesitate to contact us. We're here to help you with any questions or additional assistance you might need. Thank you so much for your time and attention today. Remember, we're committed to your success, so feel free to reach out whenever you need.